I'm Dr. Erica Lucier. I'm an optometrist here with LOI Care. I work out of our Fowlerville, Howell, Williamston, and Grand Ledge locations, and I'm here to answer any questions you might have.
So today we have a few questions that were sent in previously through message and through our comments. And the first one is about contact lenses. So how does someone find the right fit for contacts that they need for their eyes?
Okay, that's a great question. So coming in for a comprehensive eye exam and contact lens fitting is the first thing that you should do. Contacts, not every same contact will be perfect for every eye. We'll take measurements of the front surface curvature of the eyes and also the diameter, as well as taking a look at the health of the eye. And all of those things put together will help us to determine which lens is appropriate for your eye. So,
there's another question about contact lenses. Are there different lenses that you can choose from, or is there only one brand out there?
So there's a lot of different brands of contact lenses, and there's also a lot of different modalities. So some contact lenses can be thrown away after 30 days, some contact lenses 2 weeks, and others 1 day. And so you do have that, as well as many different types and coatings on the lenses. Some are more comfortable than others, and there's always new technologies coming out.
So speaking of coating, are there lenses that are polarized?
Yes, so you can get polarized sunglasses, and polarized glasses, what that means is when we have light coming into the eye, it's coming from all different directions. In polarization, it's actually going to cancel out the horizontal light that comes in, so only the vertical is coming through. And when that happens, it reduces a lot of glare that people can experience. They're most beneficial to boaters, water sports, things like that, to cut down on reflections coming from the water, fishermen. There's also some people that polarized lenses are not appropriate for, such as pilots, and that can actually reduce their viewing of LED screens in the cockpit and things.
Okay. And if somebody's never used contact lenses before and they're thinking of making the switch, how do they make that switch or that adjustment?
Okay. It's a great question, and I do have many patients that will come in first-time wearers. A lot of first-time wearers will actually start coming in when they notice that they have trouble reading, and if they don't want to wear reading glasses all the time. And so what we would do is potentially fit with a multifocal contact. We have contacts that will kind of give you more of a range of clear vision. And other things such as monovision. Some people have probably heard that term thrown around, where one eye is set for distance and one eye is set for near, to kind of help with the reading as well. But then you also get first-time wearers where they might be younger and they just don't want to wear glasses anymore, so they wear contact lenses to help with things like sports, where they don't want to have to wear glasses all the time. So a first-time wearer would just come in and we would do a contact lens fitting.
If somebody has dry eyes, are they still able to wear the contacts?
So what we would have to do is just evaluate the extent of the dryness. Generally, it is not a disqualifier. What we would have to do is get the dryness under control. And after the dryness is under control, we might choose a different lens modality. So we talked about the monthly disposable, 2-week disposable, and daily disposable. We'd probably aim for something more like a daily disposable, because they tend to dry out. They don't tend to dry out as quickly as some of the other modalities. A little bit healthier for someone with dry eyes.
So say you are a contact lens wearer, you're going to be new to putting these on your eyes. Is there certain maintenance that you have to kind of take care of the lenses or your eyes in general? Yeah,
so depending on the type of lens, if it's one that you wear daily, take out at night, there is a storage solution involved where you have to clean them and then store them while you're sleeping. If you have a daily lens, you actually kind of cut out on that altogether, and there's no storage involved. So you would just use the lens and then throw it away after that 1 day of wear.
What happens, this happens to a lot of people, but what exactly happens when you fall asleep and you still have your contacts in?
Okay. Good question. So depending on the lens type, some lenses are actually FDA approved for overnight wear. There aren't many, but if it is approved for overnight wear, then generally you can sleep in that lens because it has a higher oxygen permeability to it. Most lenses that are only recommended for daily wear, if you try and sleep in those, the eye isn't getting as much oxygen, and then it can make the surface more compromised and prone to infection, such as a corneal ulcer. You can get hypersensitivity reactions. It's usually not a good situation if there's a lot of overnight wear.
So it won't just like stuck to your eye?
Yeah, usually it's not going to just stick to your eye and you can't get it out. If it gets really dry, then it could be more difficult to get out, but it shouldn't be impossible.
Okay, sounds good. You run out of lenses. Is it safe to just keep wearing the same pair over and over, or is that a concern?
So I generally don't recommend doing that. Using the same lens for longer than recommended, it increases your risk of infection. That lens acts like a little sponge, and it can just grab onto all the extra bacteria and deposits that can build up on the lenses. And then with that sitting on your eye all day long, you're just kind of at a higher risk to have some kind of infection occur.
Now, if we move on to glasses, do they need to, if people want to just browse glasses, you have a fabulous pair on today, so say they want to come look at it in person, do they have to schedule an appointment to do that?
Okay, good question. So no, you actually don't have to. You could come in anytime. Our optical shops are open, and the opticians would be more than happy to help you select a frame that fits your face well and help you out with your glasses as long as you have that prescription.
Should they have an eye exam before they actually come in to look at glasses, or how does that normally work?
So it could go both ways. If you already had your eye exam and you have your prescription to give them, you could actually order your glasses that same day. If you haven't had an eye exam and you don't have your prescription, you could pick out the frame, but as far as ordering the lenses to go into the frame, you would want to get an eye exam to get that. Now, sunglasses, though, you could walk in and just get sunglasses without prescription in them, and that would be fine.
How often, you mentioned eye exam, so how often should somebody actually get an eye exam?
It's a good question. So generally, before the age of 60, I'd say every 1 to 2 years in a healthy eye, and then after 60, our rate of having ocular disease increases, and so after that, I would say coming in yearly, unless if something is found where you need to come in sooner than that.
And you mentioned the fabulous sunglasses that you guys have. Mm-hmm. Is there, besides looking good, are there any other particular reasons why somebody should definitely wear sunglasses?
Absolutely. So wearing sunglasses, it can certainly be a fashion statement. But in addition to that, having that UV protection on your eyes is very important. And you want to look for something that's 100% UV. There are sunglasses out there that may have a darker tint to them, but they aren't necessarily UV protecting. And so that's not going to do a whole heck of a lot for your eyes. It can actually make the pupil of the eye larger, and if there's no UV protection, you're actually getting more harmful rays into the eye because of that tinted sunglass. So looking for UV protection is very important. It's going to help prevent things like cataracts, macular degeneration that affects the center of the vision, and even wrinkles around the eyes from squinting all day in the sun. So wearing sunglasses is very important. A lot of our sun damage actually occurs before the age of 19. If we aren't wearing eye protection, we kind of see things present later on after that. So put your kids in sunglasses.
If you come in for an eye exam and Jim on here has a question, he's been told that he's nearsighted. Mm-hmm. What exactly does that mean?
So nearsightedness is a type of, it's a condition of the eye that requires refractive correction or glasses. Generally, in someone that's nearsighted, you can see things up close perfectly clear, and then you look in the distance and things are blurry. So wearing a pair of glasses will kind of counteract and correct that. In someone that's nearsighted, the eye is typically a little bit longer and light's focusing in front of the thin tissue layer called the retina. And so those glasses will actually just push the light back to where it needs to be to focus right on the back of the eye.
How do you normally test for that?
So we'll test for that during the eye exam. There's a part called the refraction, where a glasses-like object with a lot of different lenses is put in front of the eye, and the patient is given choices, which choice looks clear. And that's how we find the glasses prescription.
So if somebody comes in and, they have to get a dilation, let's say, for their exam, does that hurt, or how does that affect the
Yeah, so dilation is very important. The reason that we do it, I always like to usually start with that, is to take a look at the health in the back of the eye. We can get a limited view when someone's not dilated, but having the dilation just really opens things up so we can see far out on the inside of the eye. So that's the reason why we like to do it. Will it hurt you? No. Will you have some side effects? Yes. So Generally, it lasts for about 4 to 6 hours. Because it's making the pupil large, you're getting more light into the eye, which can cause light sensitivity afterwards. And then depending on your refractive error or what your glasses prescription is, people are affected in different ways as far as blurred vision afterwards is concerned. More than likely, though, it's the near vision that's impacted the most after dilation.
What should people expect when they do come here for an eye exam, like a general eye exam?
So coming to LOL for an eye exam is very comprehensive in nature. We really like to take a look at everything in detail, be very thorough, and address anything that needs to be addressed.
What can an eye exam tell a patient about their overall health?
So the eye it's really a window into the health of the whole body. We can see a lot of things in the back of the eye. When somebody has something systemic going on, the biggest one that comes to mind first is just diabetes. Diabetes affects the vessels of the body, and the vessels of the eye can also be affected. So we can see those signs in the back of the eye. High blood pressure, high cholesterol, or others. But certainly the health of someone's health can be seen in the back of the eye.
Well, thank you so much for joining us, Doctor. And just so everybody's aware, if you buy 12 months of contact lenses, you get a discount on $50 off of your eyeglasses.
Yes,
So
thank you.
stop by. Thank you.